Poor health for people in society results in waste potential, causes disparity, and leads to a loss of resources in every area of the economy and society. Unfortunately, health inequality exists, and they result from the social and economic condition in which people live. So, how we can best reduce disparity in the USA healthcare? We can do this by reducing inequities in healthcare through the social gradient. To reduce health inequity across the social gradient and address this problem, we must first understand what the history is and how the healthcare system works. The USA healthcare system is unique among advanced industrialized countries, but the health disadvantage is health disparity in access to healthcare system. The United States has a mixed healthcare system in which most citizens are covered by public or private insurance, and currently no general requirement for people to have medical insurance. This complexity, the lack of harmonization between the insurance model and the care model, the variety created at the level of providers and organizers have led to a global inefficiency of the healthcare system, despite the highest healthcare expenditure in the world. The lack of health insurance, therefore, is not uniform, and disadvantaged people consequently face more health difficulties than insured Americans. In addition, public assistance programs are not accessible to all people without insurance or without under insurance, and this creates more inequity in access to health service. Many of these people do not seek medical care because of the prohibitive costs involved, and thus often avoid regular screening for disease prevention. Furthermore, over time, medical expenses such as the latest drug, medical supplies, and innovative technology have become increasingly expensive and unaffordable to marginalized and poor communities, as payment of medical bills and other medical bills have become increasingly high. Therefore, health inequities are due to the high cost of health service. They are not covered by health insurance and cannot be paid out of pocket by the indigent. This is also due to the increase in the cost of medical service that comes with the rise in chronic disease, including obesity. This happens because disadvantaged people who do not have access to the screening and prevention programs get sick more easily. Nationally, chronic disease contributes enormously to healthcare costs. High administrative costs are another contributing factor to the inflated cost of the USA healthcare. The reason for the excessive costs incurred by the administrative side of the USA care can be traced to the fragmentation of the system to a multiplicity of private and public insurance companies, each of which has its own administrative apparatus with its own accounting rule and procedure that require many employees. Also, the lack of digitization of healthcare that would streamline this huge bureaucracy inflates spending on the healthcare system. All this money could be used differently to improve care and access to the healthcare system. Another part of the problem is ethnic diversity of the American physicians and nurses. Ethnic minority physicians and nurses are underrepresented, and the language and the color barrier for the ethnic minority, who often are the most disadvantaged and poor, makes access to the healthcare and service problematic. Disadvantaged population may be more vulnerable to deficiencies in patient-provider communication. All the consideration about the lack of inequity in the USA healthcare system have inspired me to look for and find solutions that focus primarily on moving the country closer to the universal healthcare insurance coverage. This can be achieved by reducing the cost of insurance because prices now are too expensive, so more and more people cannot afford it. To accomplish this, I propose to create a state public health insurance plan, which will replace and compete against private insurance plans and choice of the user. The public insurance plan will put the state in competition with private insurance, putting downward pressure on insurance policy market. In addition to this, the American citizens should be given the option to purchase private insurance coverage. in any state of the union because cheaper options exist in certain parts of the country. This will give people the ability to purchase insurance through more competition because it will expand the insurance market, which will lead to the lower prices. Expanding the number of insurance will thus become a matter of equity in the sharing of health insurance costs by all citizens, not just those most in need of care. Therefore, lowering insurance prices will encourage younger, healthier people to buy health insurance. Among the problems associated with the healthcare quality, disadvantaged population may be more vulnerable to the lack of communication between patient and provider. A solution to mitigate this problem that inevitably create health inequities is to increase the diversity of the healthcare provider workforce. For my part, state and private organizations that recruit, educate, and hire public and private healthcare providers should reaffirm their commitment to supporting the diverse workforce that best satisfies society needs. They should increase programs that recruit young healthcare students from historically underrepresented backgrounds by supporting them with scholarship to promote workforce diversity. Another solution to improve health disparity is that the government and federal state should support the development of tools to improve the health literacy and vulnerable population, such as creating and implementing language service that improve the cultural competency in healthcare and of population of different ethnics or maybe with low levels of education. Uh, at the same time, they should train and offer healthcare provider system to facilitate understanding in healthcare of different ethnic minorities. The problem of misunderstanding between patient and providers leads to a misunderstanding to the treatment recommendation and therefore the health inequities. Health literacy intervention could successfully improve healthcare disparity, including lower disease prevalence and severity, fewer emergency department visits, fewer hospitalization, and increased self-management and cancer screening behavior. But with also resolving misunderstanding between patient and providers by diversifying the health workforce and increasing health literacy, this will lead to a reduction in health inequities. A final solution for improving health inequities is to invest in the digitization of healthcare. Consider, for example, the opportunities to bring specialized high-quality care to previously underserved population. Telemedicine access leverage standardized electronic health records to extract routine data for real-time disease surveillance, clinical trials, and health system management, making them more agile and effective. The use of telemedicine can provide video consultation. When using the underserved geographic area, it can secure the service of specialists from various fields. Also can provide equity access of skilled healthcare in remote area and underserved population could be improved through telemedicine. Many providers still rely on manual process for administrative and other transactions, incurring excessive costs because they require many employees. Digitization of healthcare would streamline all this bureaucracy that inflates spending on healthcare system, this providing the doubts of skeptics. I can say that this solution could intervene on health inequalities by improving the overall health and economic prosperity of the country.